Heshett, and I'm the director of the Catherine Densford International Center for Nursing Leadership, and I want to welcome you to the School of Nursing, the Benson Healthy Communities Innovation Center, and to this great collaborative partnership with the Behavior at Work Collaborative. I think this is going to be a great program tonight because one of the themes of the Densford Center is advancing innovation leadership through creativity and wisdom work. And so the subtitle of tonight's talk is Healthy Interprofessional Work Environments, Wisdom from the Field. And we've got a lot of great listening to do and dialogue to engage in. And so I want to invite now my good colleague and friend, Dr. Judy Pekaczyk, and she will set the stage for us, introduce our speakers, and sort of give us an overview of the evening's events.
Yes, thank you. Thank you for allowing us to be in this space. It is just beautiful, and I think it has great energy. So we're coming together today to really learn from a group of individuals who are forming a collaborative called the Behavior at Work Collaborative. That group will sit in the middle of the circle and they will talk to each other about how it is to do this work in community with each other, with their work environments, with their colleagues, with their partners, with all the individuals for which they interact. And we'll pose a couple of questions to them to get it started. And then you, outside the fishbowl, you'll be sitting in the next tier outside, will also be posing questions. So you can either get in the fishbowl and sit in there and talk with them, or you can pose a question from outside and we can ask them to have conversation about that. The intention of a fishbowl is really to inform us about what is happening in the field and where we'd like to see it advance in the future. So it's intended to be organic and fun, participatory. We are taping this so that we can allow others who are not here tonight to be able to see this and experience it as well. And we'd like to do more of these if there's interest from our community. So thank you for being here. Our whole goal is to increase healthy behaviors and eliminate harmful behaviors in the healthcare workplace, and we know that we are only going to do that through interprofessional relationship with each other. So we need each other to do this work. First, though, we did want you to be able to have a little bit of community time with each other, so we were going to do just a little bit of what's called speed networking. So how we do this is we stand up, we meet somebody who we don't know, we introduce ourselves. Now, you probably have been doing a little networking already, but what I'd like you to do is chat with each other about the work you've been doing to advance healthy communities, healthy interprofessional collaboration, healthy environments. What have you been doing in your workplace as just the topical area under your introduction? So we're going to do this maybe twice. So if you'll start now, and then I'll ring the bell and you'll notice switch. I'll ring the bell and then we'll come back together.
I'm retired.
Simulations. And then
Really good ideas. Usually not as much time to devote to they work within hospitals and
we have so they do that.
maybe come up.
Thanks, everybody.
But don't worry, I get that a lot. I pretend that I really did that.
Did you meet somebody you didn't know before?
Yes.
And did you have a conversation where maybe you learned something that you didn't know? Emily, I'd have you join over here the fishies in the bowl, please. And the rest of us will be here. Yeah, little fishies. Guys are quiet. We don't need to be quiet. We don't have to be.
Okay.
So let's snuggle in, since we're a nice, tight, close group. Come on, everybody in.
No, that's.
To the right, okay. Yeah, well, there are writing papers if you feel like you want to take notes. And there, if you feel like you don't necessarily want to speak and want to send a note into the fishbowl, you certainly can do that with those notes. So thank you for being in the inner circle. And we really don't need to be so quiet. We can be slightly disruptive. So what I'd like you to do is introduce yourself and a little bit about your role. Just take a few minutes, each of you, to talk about yourself and your role in this work. And if you'll just reference the good of this work and the ugly of this work from your perspective and vantage point, and we'll start there, and then we'll go to questions after that. Want to kick us off, Mary?
I'd love to. I'm Mary Stokes, and I'm an executive position.
Oh, and I'll speak loudly.
Speak loudly because it's.
Speak, okay, so the room is mic'd, but we need to speak loudly, so as you can tell, I am using my outdoor voice.
I have a good outdoor voice.
Yes.
Good outdoor.
Yes.
I'm Mary.
Perfect.
I'm Mary Stokes, and I work as an executive and physician coach. I have my own business, and I work in healthcare. I've worked in healthcare for 15 plus years. So what I do as a coach is I get to work with some teams. Mostly I work with individuals. And so the good is that as a coach, the good is that I actually get to see into people's intentions. I get to see deeper about why do they behave the way they do, and what are some underlying factors in their behavior. And especially the good news is when a light bulb goes off, or they have some awareness and are motivated to take steps to change behavior. That's the good news, and I see it every day. The bad news is when that's not the case, when for whatever reason the person I'm coaching isn't able to accept responsibility for their behavior, the impact of their behavior, and therefore for me probably uncoachable if they're not able to accept responsibility for even a small part of what's going on in their environment. So that's the ugly, not ugly, which is bad, because I'll usually say you would be better served by something else. Therapy.
Good. Well, I'm Jennifer Grady. I'm the director of HR with Minnesota Gastroenterology. I've been employed there for 14 years. There's two goods. One good has been being with this collaborative of such intelligent people that get together, and every month we're going to get together and talk about behavior and how it changes our interactions with other people, with our patients, and it's at 7:30 in the morning, and I hate 7:30, and I get there and I leave and I think I'm so blessed to be around these people once a month and be able to do the work that we're doing. It's amazing. From the HR perspective, I often have to have tough conversations, and a lot of them is around behavior. People can do tasks all the time. We can all check the box and make the trinkets, but it's the interpersonal skills that wreck the product. And I think being able to have those conversations, and I've had them, and they've stopped, and their manager, I don't know what you said, but they're really doing better. And those are the big wins for me. Unfortunately, the bads are they don't win and they end up exiting our organization. But behavior makes kindness makes such a difference in everything you do. So,
And sometimes an exit is a win.
sometimes it is for everybody too, and they get to take that. If anyone's ever lost a job, you reflect back. Most people reflect back and think, what could I have done differently? And so it is a win.
I am Deborah Anderson, and I am a consultant and do work with hospitals, clinics, I've done it with public sectors and academic institutions. And I think the good about this is that it is phenomenal how it's everywhere now. I mean, 25 years ago, 30 years ago, if you talked about a healthy work environment, they said, oh, do you get gyms in organization? And so it's just, you can't read everything anymore that's going on. And it is wonderful to see groups get so proactive about let's have great working relationships. The bad is the denial that still exists, particularly when it's in the senior ranks, because it just keeps everybody from being able to do the work. And the ugly is when people they use their position to be really nasty to another person. That is honestly very ugly to see. And it does happen.
I'm Lori Drill-Mello, and my background is in emergency medicine, and that's where I first met Deb, because she worked with our emergency medicine group, and we had some behavior and culture problems. And subsequent to that, I joined this collaborative, and it's really important to me in my current role, but it certainly has been in my professional role in emergency medicine, and also I'm a medical director of hospice, so this is important in that role too. But I worked for a malpractice insurance company, and although it's often difficult to tell when you look at when things go wrong for claims and lawsuits, that it's a behavior or cultural thing, at a minimum we see in our analysis of our claims and lawsuits that communication gone wrong contributes at least 30% of our cases. So, and of those cases, 70% of them are provider-to-provider communication, which is a lot of what we're talking about. It certainly is also patient communication. These cases that have communication as a contributing cause are more likely to end up with an indemnity payment, and that they're more likely to be more expensive. So we see this, and if that's not reason enough to address it, I don't know what else is going to make an argument, but I mean, we thought it was important before. I suppose the bad and the ugly is also the opportunity, actually, that there are good solutions to a problem that's common in healthcare and in life. So there's lots of opportunity.
I agree about the opportunity. That's really good part of this.
Yeah, that's a great part. It's the different sides of the same coin. There's a lot of problems out there, but there's opportunity and tools to address it, and I find that inspirational.
Yeah, and more good news is that communication can cause behavior.
Right.
I mean, it's a workable issue.
Yeah, I have this theory of change, and it's distilled from lots of reading about change, and somebody might say that's so-and-so's theory of thinking. But first is recognition that there's a problem. So however you recognize that with measurement, there's recognition that there's a problem. Then there's motivation to do something about it. And so that, whether it's in your work group or your culture or whatever, whether it's your C-suite, there has to be motivation to address it. And then there's tools and resources, because most people, they might have one and two. And I say if you don't fulfill the first one or the second one, you might as well just stop. But if you have recognition, then motivation, then tools and resources. And what we know in the Behavior at Work Collaborative is there are tools and resources to apply to this problem, and then accountability. And once you put all those things together, then you can actually affect change. So.
Yeah, and we know that it works.
And we know that it works.
I'm going to move you a little bit because we're getting the back of your head and we want to see who you are.
No, you don't move.
No.
Great.
For a little ride.
So where do the three of you think this is going to go? What do you think is going to make it kind of more successful? I mean, as a question of, you know, when from your, because I think the thing that is the most interesting to me about the collaborative is our different points of view and our different experiences. And this is such a big issue in a certain way that we each have, you know, a view on it.
You know, I love that question because, I mean, we can lose sight of that, where it's
Yeah.
going, because as a collaborative, we just have so much fun sharing ideas and information that we could actually be self-contained and be happy
Yeah.
and not answer that
Yeah.
question about where are we going and where can we go.
Yeah, and where's the topic going to go? I mean, if you look on the internet, it's just exploding.
I think as a mom of 3 small kids in school, that word bullying is finally out there. And I hope it doesn't get overused, as kids will do, but you're starting to pay attention, and children are starting to pay attention that behavior is not okay. And I think that that's a good point, as opposed to that doctor that thought it was okay because of who I am, just throw the instrument in the procedure room. That's not okay, and I think we all recognize that those things aren't okay anymore.
And the silence is going away with it.
Do we have questions from the audience?
Yes.
Well, I want to ask a question, and this is for Mary and for Jennifer, about individuals who are bad behaviors, we'll call them, behaving bad. So, first of all, for Mary, how many of your coaching opportunities are not rehabilitatable?
Well, I would say 0 of my clients, because I won't accept a client I always start with an initial, check each other out, and decide if this is a good match, if we're good, if we're working together. And I can very quickly assess whether I think they're a viable coaching candidate, meaning willing to look at themselves and work on growth and change, and accepting some responsibility. So I would say 0 of my clients would meet that description, but how many people I meet, it's a small percentage, 10% maybe, the people who are potential coaching clients, I will refer elsewhere or say, not good match.
Then what happens to those individuals?
As far as I know, and I don't have a ton of data to track what happens to them, most often they have left their employment or been asked to leave. their employment.
A lot of times they don't stop.
Yeah, one was a medical director, and a condition of employment was that he would receive coaching, and we basically agreed we didn't want to work together. He was removed from leadership. Not from the organization, from leadership.
And then for Jennifer, those people that you have to ask to leave because they don't change their behavior and they go through what process you have for helping them. What happens to those people?
You know, I would say that we have a Golden Rule Committee, and that's been probably, and Deborah helped with that, 10, 11 years going. So there's that expectation when you start employment with us that you treat people fairly. I know it doesn't always happen. So we implemented site medical directors. We have a site administrative director at each of our locations and a site medical director. And when there are behaviors that aren't appropriate, it's doctor to doctor. And so there's still a little bit of that hierarchy, but I think that's okay. I think we're moving in the right directions, and we're training our site medical directors to be able to have those difficult conversations with other providers to say, hey, Bob, we've known each other for 10 years. You can't do that. That's just not okay. And so coaching through that more, I can't say that I've had a provider that I can think of, which is good, be so unreasonable because we set that expectation up front. So.
But I remember, Judy, when you were chief nursing officer, and you did some of this work in one department, that there were people that just decided they didn't want to, change and left the organization. I don't know if you know what happened to them. I remember you saying some came in line and some said, I don't want to do this.
Yep, right? Because we believe behavior is a choice, and if you choose not to comply with the new rules around how we want to treat each other here, then you probably want to work in a place where you can have those behaviors, and there's typically places people can find.
Yes. Outstate.
Unfortunately.
Well, yeah.
Well, yeah, we
Yeah.
see this actually.
Yeah.
We
Yeah.
do.
But we know that cultures can change, but it takes the staff to lift it up and to hold each other accountable. It cannot be administratively forced. It has to be organically believed in. Administratively, though, we have to lead it and champion it and also be good.
Yeah.
We can't show bad behavior, because I think what you said, it'll cause us all to fall apart if your senior executive comes on the floor and, you know, swears at people or pulls rank and does bad things.
Right.
We lose all credibility.
Well, I think when the organization, when people are dying to talk about this, they want to talk about it. You know, in the surveys, 95 to 100% of people say we should do this because they want to do their best job. They want to work and really do a good job, and they can't when this stuff's going on. So once you start getting rid of the silence rule and everybody's not walking around the elephant anymore, they start kind of taking care of each other and having more conversations. And it's kind of what you said. But it has to start somewhere. And it sometimes it's really different places it starts. And sometimes it's not terribly organized, but it happens. You know, with somebody in the organization just starting to deal with this stuff. It spreads in a very positive way, and the negative is contagious too.
So you're speaking about awareness is typically the first step in this work. Somebody gets woken up about this and decides it's not okay anymore, and then they try to build people around them to be different. Could each of you talk about that from your vantage point, your perspective? How do you increase awareness for this work in the groups that you are influencing and practicing in?
I have increased awareness in that very beginning by a survey that it becomes a mirror. Because if I start showing them or talking about their behavior, you know, it's kill the messenger, believe me, and they're very good at it. So,
What kinds of things do you assess in your survey?
well, you know, what behaviors they think are cause harm, how much of it's happening, who is it doing it, you know, who sets the tone, how much should they be involved in this. So it becomes a mirror, and they're all very, very interested to see what did we say, comments about what is happening. And it's all anonymous. But that is sometimes, for the people who use this behavior, they do not like it. But everybody else is relieved that finally somebody's, you know, we were able to say stuff.
Yeah, I think getting data and surveying is really important. That being said, I read an article this year about why people don't fill out surveys, and it's because of fear or futility. So you have to make sure that if you're going to survey on behavior and culture, that it really is anonymous and that you're going to do something with it. So that's what I talk about, and we have done surveys in our workplace, our corporate world, and then you actually have to do something about it. You have to talk about it, you have to engage with your team and figure out what pain points are and then attend to them and then resurvey. So that's kind of the model I think works. It's this model of measure, engage, and then, you know, do something and remeasure. I mean, it's kind of simple improvement science, but
It is.
a lot of people stop. I mean, people have survey fatigue. They do, because they go, well, the futility thing, or am I going to, is somebody going to look up where this survey came from, so can I really be honest? That fear factor in this day and age, like, it's real. And they, I mean, you know, you got to decide if you're going to design it that way. Otherwise, people aren't going to trust you necessarily. So.
And they have to hear the results, they have to see the results, and because they can't be hidden.
Right.
So one of the things we did was, with Deborah's help, look at what are healthy behaviors and what are harmful behaviors. and make that list that this is a healthy behavior. Thanking someone, saying good morning. You know, how many times do you walk past somebody and not say good morning? None of what are unhealthy behaviors. I'm thinking about keeping information from your coworkers or not talking to them. Those are really hurtful behaviors, and that's what stirs up all the ickiness. And you can tell when you walk into a department, what's going on here, because something's not right. And it's
You can feel it.
You can feel it. And so we took our ID badges and we wrote the healthy behaviors and harmful behaviors. So, and sometimes it was a joke, you're not being very this, but these are our expectations, and again, to be kind and to have healthy behaviors. And hey, you are doing this, and we wear this next to our heart every single day. That's our expectation.
Sadly for me, because I'm not inside a system, I work outside of systems. Usually, my point of contact is from a pain point. A physician got in trouble. Somebody got in trouble, and so they're sent to me, or they have to work with somebody. So that's not a really good place to begin the conversation because it's been happening for a while. That said, any starting point is a good thing. Any beginning of the conversation is a good thing. And I'm thinking of one particular client, and I can't reveal specifics, but just the tendency the first time we met, it was like 95% the organization's fault and 5% is maybe. And we wasn't really having a lot of motivation to improve internal relationships with internal people. Great relationships with patients, but not very good with colleagues. Well, as incidents increased of getting in trouble, the motivation grew. And now I would say it's probably 60-40. I mean, it's a much better percentage of owning responsibility and saying, yeah, I guess there really are some things that I personally have to take a look at and change in a way. And the problem now is, of course, perceptions are pretty set.
Right.
So now we're working against how he is believed to be, even if he's found motivation to be differently. So now we're on that uphill.
What's really interesting about that, because I've heard so many times when somebody with that kind of reputation goes and tells somebody, I'm sorry for what I did, that like spreads like wildfire. It's like, he's sorry! And it just spreads like crazy, so any of that really goes. Or he said hello to me in the hall.
Wait, did you hear that he said hello? Everybody knows that?
Or thanked me.
Right.
So thank you.
So you're segueing into interventions that possible suggestion that Mary could use with this client, that an intervention this individual could use would be to overtly use very positive and good behavior to see if he could change those perceptions. I know we have a question from our circle, so we want to get to that, but before we do that, will you just mention a couple of your top one intervention that you like to do with your clients or those who serve from your perspective that you know is really effective?
And I'd like to learn more about what is a golden rule committee.
That's good to know. Me too. Excellent. Do you want to throw your question in?
Yes, and I know you're probably going to talk about this in a little bit when you start giving us some intervention and some best practices, but I manage a team that's very virtual, so there's 32 individuals at 32 different locations. I'm looking for some help in how to create this kind, healthy working relationship, even though we don't see each other every day. We have phone calls, we have emails, and as we continue to be more and more virtual and more off-site. I think that's what brought me here, is to be able to say, how can we still be kind over email or over phone call, or as we, and so my goal was to learn and to take away some one or two best practices to help foster that among my team.
I have some thoughts about that question. When it comes to, and I know Deb does this in her work and working with teams, when it comes time to developing what you might want to call habits of engagement, the people that develop the habits should be themselves. Okay, so for example, on email communications, you could have a subcommittee of your department, say 4 to 6 people, develop what they think are best practices for email communications. A salutation, a question, a message, a closing. You know, I mean, many people just, and probably if we all look at our email communications, sometimes it's just, I need this now, or, you know, see you tomorrow, or whatever. But you could come up with best practices, the subcommittee, and then they could present it to the rest of the team and see what they think. So this whole concept of habits of engagement, whether it's virtual or whether it's in-person meetings, if they're engaging in a regular way of things that they all mutually agree on, so engaging them in the process, and then having a way to respond when somebody breaks a habit. And typically, in your ideal world, it's something funny. Like in our group, we came up with this word pineapple, and it came from the Steve Irwin video on some talk show where he had a tarantula going up somebody's arm, and when the person got too scared, they'd say, pineapple, and then he would take it off. You know, he was that crocodile guy.
Sure.
So, but something funny. But, you know, it could be like when you have these virtual teams, you know, you make sure you have a check-in at the beginning of every team meeting or every other one. 30 people's a lot. I know that when you're online, you sometimes can break out into small groups because I've been a part of that on Zoom or something like that. But having agreement about how you want to treat each other, because that is what builds trust, interpersonal trust, and with that, that's what builds the ability to work more effectively as a team. So those are just
I want to jump in and just support what you just said, Lori, about having the team, devise these habits.
Yes.
Also, habits of engagement, you're calling them?
Yeah, habits of engagement.
You could also call them ground rules. You could call them compact, which are gifts and gifts.
Yep.
There are all kinds of names for the concept of we are agree on how we're going to interact together. I love the idea of the chat rooms for part of the meeting, part of a virtual meeting, to have smaller groups, because it's very easy to hide in a group of 30.
Right, but then you can come back. You can have breakout sessions and then come back and present whatever your findings are. That's what I've been a part of that kind of meeting.
When we've asked people if somebody has an issue with you, do you want to know it? About 90% of people say, yes, I want to be told. But only about 40% of people say, I would tell somebody if I had an issue with them. So how do you build that up? And the biggest barrier is the behavior they use when you're trying to communicate with them about it. So, and privately. And there's some real common things that by asking people, how do we want to go about this? It also works so well because it's not you, it's us. When you do that. This is what we wanted instead of, because you always get in trouble as a senior person when you are making.
Right. And it's an agreement. And the groups I work on, it's signed. It's a signed agreement. That's what we agree to as a condition of being part of this team.
Is there any connection, like kind of that heart connection to each other in building those relationships? So I know you're counting on me, and I remember being in college and that being hard, people not pulling their weight, or someone always having to do the work. So how do you connect them all together? I can see that being very, very hard being virtual. I don't know if it's, we have a app on our phones, it's called Slack, and it's just my HR team, and we post silly things like, hey, there's a pub crawl, or hey, did you guys see this? Or it's just the way for our small team to just connect. And then it could be an article, it could be a news story, it could be whatever we want. And it's Slack, and you can just set up your team to do it. So you're able to talk. It's not Facebook, you don't have to give the full everything. But there's so many apps out there to help with those things.
And kind of that concept with virtual teams of just encouraging people to pick up the phone more.
Right.
Because it's not that big a deal to pick up the phone and call your teammate, but a lot of people don't.
No.
So, I don't know, maybe having personal goals of, I want to make at least 3 calls a week, and then seeing how people do it. I mean, you could compete on those goals if you want to. Sometimes people like that sort of thing, but actually,
like she does.
No. Yeah, right. Well, you don't connect.
Oh, right. They don't see each other.
They're breaking the 7 days and, one person will do the 3 days, and the other do 4, that they, even though they're clinic partner, they don't see each other. Yeah.
Do they leave each other notes or anything?
Yeah, we have a communication book, but I think I just want to be more purposeful and thinking about, as we lean on each other and, call off, happen people have things that happen in their personal life, and I'm the one that owns everything and knows everything, but I also want them to be comfortable enough to say, hey guys, here's what's happening in my life, and for the next 3 months or 3 weeks, I'm gonna need you guys all to help me with Thursdays or Tuesdays or whatever. To me, it's like, I'd like to move us to that level of, even though we're so virtual, there's still that human connection.
One of the things that we do when we bring our team together a couple times a year, we're in 18 different states. And so when we do come together, and you could do it on the phone too, but it's pretty powerful when it's together. We have a check-in and we ask people as an opening exercise to share a joy or concern. And it can be personal or work-related, but you find out what's going on in people's lives if they want to share, and if they want to pass, that's fine too. But it does create connection and empathy and understanding among your team, because this concept that you're just all work or all private isn't really very realistic. I tell people we bring our whole selves to work, right? To think that they can be completely divided is fantasy. So, anyways.
I would recommend at least a couple times a year that you have a meeting just dedicated to the teamwork, to building relationships among each other.
Another thing that has kind of really worked in organizations is to draw a little algorithm of how do we communicate with each other, a roadmap. Because everybody doesn't put the same roadmap in there. Yeah. And then they all see it and it becomes the roadmap. Besides that, if you're having an issue with somebody in a way, you kind of go brain dead when you think about what am I going to do. So if you have a roadmap, it really kind of helps. What if the person says no or whatever? And Rob's done that. I just took years for another thing.
Stu, did you have a suggestion or comment?
Well, just the one thing I would add, excuse me, if there is some conflict, you just can't do it by email. You've got to be more personal, either telephone, but preferably face to face when you have conflict, and not to have the whole group know what the conflict's about or anything. Just deal with the people who are in conflict, but doing it by email, and I've seen anger go back and forth on email. It's just dysfunctional.
It escalates.
I remember watching very early in my HR career, just a generalist, not too far out of college, watching 2 women that were in their mid-50s, had worked together for 5-6 years, and they could not get along. And so here I come, all, 25 years old of me, and there to help these 2 adult women figure out what it was, and it was horrible. The one woman kept treating them, every time she'd walk by her, she'd go, tisk, 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 every single time. And they worked in their cube walls or whatever, and it just broke this other one down, and things about her being overweight, and this one was really healthy, and just icky, horrible, harmful behaviors. And I thought, it was, we had to talk through, how are you just going to make this better? How are you going to work together? And everyone always says, you don't have to be best friends, you have to work together. You have to be kind. And I just can't, I remember thinking that, and one of the women has retired now, and it just made me so sad that we would treat each other that way.
I've also been surprised how many employees want their managers to be very active on this, too, because they don't have the power to be, and just like
skills,
and authority.
Right. It's funny that you just said that, because that was kind of my question. So the organization where I work right now, I did an organizational culture assessment and did surveys, and we have results that show that our teamwork and collaboration is very poor. And the leadership team has been aware of that for months. They haven't
done any kind of action on the results. So my question is, how do you move forward with this when I'm a full-time student, I have 2 jobs. I don't have the time to devote to fixing the team.
Or even the authority, right?
I don't have the authority either. I do have, I think I could, but I just don't, I don't even want to get in there. So how do you do that as an employee? I've been trying to model good behaviors, but that only goes so far.
I think it comes from the leadership level to say, do they recognize there's a problem? Back to my theory of change. They have to recognize that there's a problem first of all, and then maybe in your survey results, just putting up in front of them. Then, are they motivated to do something about it? In this day and age, they probably are, because they don't want people leaving the organization, because, you know, it's hard to get good employees. I don't know what the situation is, but they have to be motivated to do something about it. And then it comes into the tools and resources. And they may not have the tools and resources internally. That's where they may need a consultant to come in and say, okay, here's your assessment. This is what I would recommend. Just like, you know, like a diagnosis and a treatment plan. And usually, or often, it needs to come from an outside resource.
Do you have a lot of turnover where you work? Right there. I mean, we were talking about it earlier. Hit them in the pocketbook. I mean, there's really, I mean, that's data.
It's very expensive.
People are not staying here because of our unhealthy behavior. And recruiting costs a lot of money, and training and all of that. So they're going to keep walking out the door if it's not a good workplace, because they can go to my organization. And hopefully it's a better workplace.
Well, and the other thing is now there's a lot more motivation. In addition to that turnover, there's an issue of burnout, okay? That contributes to that. And then there's the patient experience, which now compensation is being impacted by that. The revenue is being impacted by that. And that in and of itself, patient safety is being impacted by that. Liability to be in a lawsuit is impacted by that. So there's a lot of arguments to attend to this.
Well, and I think what happens is it becomes normal. I mean, we normalize this stuff. And, you know, if you're in a culture, any culture long enough, you know, you live in a city where it's just, you know, terrible block with terrible violence or something like that, you become acclimated to it after a point. And so I think sometimes senior people, they don't know what to do, or that, you know, they're in their own little wars with each other that sometimes get pretty well covered up. And but what Lori said too, do they want to do something about this? I mean, if they say yes, then there's all sorts of resources really for them to find.
But sometimes it feels like it's hard to find that resource. Like, we've identified it, now what? I don't have time to do it all. Where do I go to get it started and make it happen? Who can I bring in? That's not going to cost our organization millions of dollars to help guide this.
And we're a nonprofit hospice in our local area, so we don't have money for a consultant. So, I mean, I could definitely suggest resources, but what are the resources available for us?
Well, and there might be ways in your hospice too, right?
Yes.
Yeah, I mean, for there to be some kind of joint partnerships with stuff where you really learn from each other this way, and maybe some help from some other people where there could even be dollars found to kind of contribute to it. But the more this comes from people internally, the better. What are you doing with that?
Well, we've done a lot of what you say. We have very clear ground rules for how we work together. We start from the very beginning down from these are our organizational values. Team value that we talk about. We rise and fall and all the work together as a team. So we're really not intentional about articulating our expectations of each other as a team. It's written in the very beginning, and then we allow people to add to kind of the ground rules. We have ground rules for when we meet together face to face. I haven't done this more with email, but people are very kind. And kindness is something that we've just said. I really loved your saying that. It's something that we say is just a value that we call each other on. And we even know enough people who are willing to do that. Our experience has been, like you said, that people want that to happen, but they don't want to do it. So I think we've got a critical mass of people that step in there and call it and kind of protect and help us sustain that kind of a culture.
To have that.
It's so funny about emails. I mean, I'm thinking of a particular position I know, and actually a very, very kind person. And she ran awry in some email exchanges with that escalated, and so she asked me to just read the chain. You know. Well, at one point, her response started with, "First of all." And so, I mean, one of the interventions, believe it or not, Sybil, is, and this is her really wonderful, kind human being, I don't even know, actually learned. She put a little note on her monitor that said, always start with something personal. A greeting.
A little.
Yeah. But not first of all.
I'd just like to bring up for your need, the Minnesota Council of Nonprofits has a lot of volunteers who will come and help small groups get started, or even actually volunteer to consult. So the Minnesota Council of Nonprofits would be a resource.
Do you know what, is that in other states? Because you're in another state. Missouri.
Yeah.
Stu, does that exist?
Maybe there's one down there.
There could be.
There could be.
Worth checking.
And I'd also suggest the Hospital Association. They are not just for hospitals, they're for all kinds. And many have grants in other states working with people. So you want to try to find funds to help finance it.
Yeah. So I was recently in a situation this summer, this is going back to the statistic about 90% of people would want someone to say something to them, but only 40% would. And I'd like to think that I've always told myself if I had an issue, I would of course say that to somebody. And I was in a situation this summer where I had an interaction with a provider. I'm a nurse, and a provider that works in my clinic who he ended up like really speaking down to me. He like took a step forward, like got over me, and was like pointing, and it really I froze. Yeah. I absolutely froze.
It's intimidating.
And I couldn't respond. Like I had to go down the hallway. I was so angry, I was shaking. And then I thought about it, and I'm like, no, I should go back out there and I should say that this was not appropriate. Like I knew what to do. I went back out there, and at that point, then he was gone. And he was on vacation for a couple weeks, and then I just haven't. And it just got too far past the fact that I didn't say anything. But what are your suggestions for I wanted to say something, but what are your suggestions for when you're in that spot and you do freeze? Like, how do you get past that?
Yeah, I want to respond to that.
Yeah.
Because I think it's such a beautiful question. The first is to make sure you're in control of your feelings. And so I think the fact that you were so angry and frozen, it was probably smart to take a little bit of distance.
Yeah.
The most effective for me is to learn the ability to be a mirror and to describe the behavior as specifically and non-judgmentally as possible. And I still remember because I was intimidated and I used the words. When you stand up and lean over me and there's this vein popping out of your forehead and you're yelling, it's scary. You know, for me anyway, that was scary to me, but to be as specific as possible in describing what was scary.
Right.
Because she didn't see herself as scary. She saw herself as powerless in fact. So just to be that mirror, to be able to describe. And she could remember herself doing
it. But I think what frustrated me is that because I didn't get to go back, it ruined my day. Like absolutely, I went home, I was like almost in tears on my way home, and then I was mad that it upset me that much and that it got under my skin. And so it was just all these feelings that elicited. And then I kept thinking, I did this, replaying the conversation. I'm like, well, did I speak in this tone to him? But then I'm like, but even if I did, you don't deserve that back. I deserve to be told, hey, I didn't like the way you just talked to me or something, So I just really struggled with that situation.
How long ago did it happen?
It was on my last day of summer classes, so was that June? In June. Yeah.
Do you still interface with this person?
No. End of July, sorry. I don't see him very often. He's only in my clinic half a day a week.
Because sometimes I've seen people go back and say, do you remember when we had that interface? And it still kind of stays with me, and I really want a better working relationship with you. And, you know, then you can kind of clear out all that stuff for you. I find the vast majority of the time people do not fight that. They don't. I would say 98% of the time people say, I'm sorry, or
The longer the time, the foggier the memory of what actually happened.
But to say that it
the
feels very
feelings
good.
are still there.
I got another technique. No, just for yourself.
Yeah.
Okay, so we all engage in self-talk. We all do. We all say, why did I do that? Why didn't I do that? What am I going to do next? What if it happens again? It's all me.
Right.
Okay. What if you were to say to yourself after something like this, what would be in Carrie's best interest? What would help Carrie the next time she sees this guy? Or what do you think would help would make it better? Or, similar to that, what would you tell your close friend or colleague? Okay? Because I am going to work from the assumption that you know.
Right.
I'm going to work from that assumption. You actually know. And so when you can sort of get a little bit in the balcony, and I agree 150% that when you're hot, it's good to just DNE. That means do not engage. Just DNE. And then think about it. And play with it. Like I was telling somebody today, I had this awful experience with, most of my career is in emergency medicine. I have to call people and have them come in and they get mad. And this one orthopedist was really rude to me one day. And I mean, multiple stories like that. But I decided I was going to experiment with him one time. Thanks, everybody.
Not to name any names.
And he was, no, it doesn't matter because she knows, but nobody else does. But anyway, so I called him up a few days later after I settled down, and I called him up and I said, you know, I want to talk to you about the other day because I'm calling to see if you're okay. He goes, what do you mean? And I said, you were so rude to me the other day. I figured there must be something going on.
Then Lori, that's how you
Yeah.
Kind.
Yeah, I said, you know, and no, that's just the way I did it. I said, well, you know, if it's that tough, you know, I won't call you in the future. I mean, I just, you know, I don't want to bother you. I'll call somebody else. But I figured there must be something wrong for you to treat me like that. So, I mean, I think you know. So just think about that. What's in Carrie's best interest? Or what would Carrie tell her close colleague? Because you probably know.
Just think though how you would respond to that if somebody approached you like that. Are you okay?
Are you okay? Wow.
Yeah, disarming. There it is.
So I'm Travis.
Hi
guys.
Hi.
So I'm going to kind of shift gears back to what we were talking about a few minutes ago and talking about. So in my situation, so I manage a family medicine residency program. So there's lots of levels within that, from front desk to medical assisting to attendings as well as residents. And so lots of different opinions and different teams. And then within our teams, our faculty and our residents are very early in the clinic, or they're very sporadically in the clinic. So we have two kind of varying schedules amongst our more set schedule of people that are together. And so recently what we've noticed is some breakdown of team, not only inter-team, but cross-team. And so we've kind of, as a leadership team, identified the problems. We've identified things like trust and lack of accountability as being some of our biggest issues. And now we actually had a meeting today, and we were sitting there and just like trying to figure out what to do now. Now that we've realized there is a problem, we accept the problem, we are invested in changing the problem, and we've sort of looked at some resources. I read the book, The 5 Dysfunctions of the Team, and looked, and I used that assessment actually on our teams to figure out some of these problems were. And now we're just like, okay, now what? And we do have things like ground rules. We have a lot of what we call standard work. And so everyone knows what their role is and knows what their position is. But it's when those breakdowns when people don't follow those rules, or people don't perceive that the other person has followed the rules. And there's a lot of, well, it would have been successful if that team had done their job correctly. And so it's very little of, we're trying to get our teams to kind of own what we can. And like I say, clean your front porch for you, invite people over. And it's catching on a little bit, but it's still very outweighed by the other opinion of, well, if they had only set us up for success, then we'd have been successful. So I wanted to get your insight on how do you decide intervention?
So there is an accountability, or people don't follow through, that breaks trust. We have, the trust is the bottom of the pyramid. So, some of those things that we talked about before about building trust are these habits of engagement, which include, what are you going to do when somebody doesn't hold up their end of the bargain? How are you going to deal with that? I mean, that's the thing. You can have all these habits or rules of engagement, but another point is, what are you going to do when they're broken? Because if you don't call people on it when they're broken, then again, that's not showing any accountability for that. But that again has to come from the team, right? I mean, it can't.
Well, maybe there's some stuff they don't believe in, that they don't buy. Maybe they say they do, but
why aren't they?
Right? Why aren't they? Because usually I find when a group won't do something, there's some silence about what they don't buy. And that, getting more of that engagement again, and maybe even taking a topic or something like that, so they have this experience of doing this work. And the accountability, if it doesn't follow through, it just ruins everything, frankly.
It's always easier to blame a unit or a function or a department than it is to actually, when you know that person and you know the people involved, it's a lot harder to be blaming. And so any cross-functional efforts, awareness building, like in a hospital system, it's so easy for the ED to judge the lab and the lab to judge the ED. Because both, they seem willing to make the assumption that the other's job is to make them miserable, to ruin their day. And of course, that could be farther from the truth. And so for them to really walk in the shoes of each other really helps build those relationships, because then that's a person, it's not a department. So I would do some work for building some of those cross-functional relationships.
One of the things that I found is helpful is to just go out and listen to people saying, this didn't work very well. We didn't meet what said we were going to do. Why do you think so? And then get everybody who was part of that system that didn't work to talk about why they didn't think it didn't work. And I think that's, for me, as a medical director, listening was top of the list to find out why things were going, what was the problem.
And if you could add to that, how do you think you might be participating in what's not going well or contributing? Just to help people start looking at their own behaviors and impact. Because you might get the answers to, well, it's not working because that department isn't doing what they're supposed to be doing.
Most of the time.
Most of the answers, yeah. And so to just, open the door, invite the question, how might you contribute to that in some way? No doubt unintentionally. I mean, I always give people the benefit of the doubt. I know you didn't mean this that way. And how might you be contributing?
Well, and a lot of communication, issues, accountability issues, really have to do with some system issues that are too difficult for any individual to fix.
That's so true.
So if some groups look at, is this a system issue that's driving everybody crazy, and they're complaining constantly about it? Or is this really a two-people issue? Is it? Which one is it? Because the communication and getting along should, like a figure eight or that infinity, should really make it much better on the systems because they can talk. But then the systems go back to people talking, because if either one of them aren't just constantly taking care of I see groups get stuck, and sometimes people don't want to talk about, this is our system. Instead of, and like going to, like Steve said,
So you're bringing up a whole nother topic, which is the work is done in a complex adaptive
Yeah,
system
yeah.
where there isn't a silver bullet solution
Right,
for the problems for which we've been living in for decades,
Right.
which is a whole nother topic that I know Dr. Peshet could help us hear about. But it goes hand in hand. Fixing behaviors, you also have to fix underlying systems because our processes are broken.
Yeah.
We do have to innovate within these spaces, but you can't innovate if you don't have trust and respect. You can't get people to use their inspirational efforts. You'll only get them using their routine efforts if there's no trust. So you have to build this place where there's good juju and energy, and you only do that by really getting a nice ground for people to walk on and that they can resolve their difficulties and that kind of thing. So I'm mindful of getting to the end of our time. How fast did our time go? Everybody in the circle did a wonderful job speaking to each other, and outside our circle, everyone did a wonderful job putting in comments. This is our time to debrief, and we had this wonderful new liberating structure we were going to debrief today. We were going to talk about what I used to think before I came today. And now, what do I know? Or what do I think? Which could be what I know, but maybe more what I think. So, yeah, what did I used to think before I showed up, and now what's different for me? So what do I think now? As our way to kind of process what happened here today, how about, should we just talk with somebody next to us with those two questions and then come together? Is there enough time to do that?
Sure.
5 minutes? So how about 1 minute, talk to each other for just a minute? Yeah, everybody talk to each other, or to pair up and say, what did I know before and what I think before and what do I think now? And then we'll just share open.
We're going to pair.
Oh, how real pair. Yes.
The keyboard, and I realized that,
I'm not quite sure. The question.
I think connect my teams, so you know, like twice a week, team huddles, sometimes.
I am.